As we get older, wisdom becomes our greatest shield, but fear often grows right alongside it. It's the fear of getting sick, of losing our memory, or of becoming dependent on others. In that fear, millions of seniors agree to medical tests they don't fully understand. These tests sometimes help, but they can also silently cause harm. This video isn't about rejecting modern medicine. It's about finding balance and awareness. It's about understanding which tests are truly necessary after age 70, and which might bring more danger than benefit. In the next few minutes, we'll explore the hidden dangers behind common health screenings, why false positives are so common in old age, and how overtesting can lead to stress and unnecessary treatments. What you're about to learn could protect you or someone you love. Stay with us. Ever notice how once you hit a certain age, suddenly every doctor's visit seems to come with a long list of recommended tests? There's a fascinating and slightly concerning reason for this. As our bodies cross the 70-year mark, something subtle changes. The benefits of many common tests can actually decrease, while the risks associated with them increase. Why? Well, our healing speed slows down, our immune system isn't as robust, and even our blood vessels become more fragile. Stress hits our organs harder, and medication side effects can feel stronger. Ironically, this is often when the most tests are suggested. Doctors have a term for this: the cascade of unnecessary testing. It starts with one simple, seemingly harmless test that flags something suspicious. This leads to another test, maybe a biopsy, and before you know it, you're dealing with complications from a procedure you might not have needed in the first place. One small decision can set off a whole chain reaction. Have you ever considered getting a full body scan for peace of mind? It seems like the ultimate health checkup, right? You lie down, the machine whirs, and you get a complete picture of your insides. It sounds so high-tech and reassuring. But hold on, what's really happening inside that machine? For a CT scan, it's radiation. And we're not talking about a small amount. A single full body CT scan can expose you to radiation levels 200 to 500 times higher than a standard chest X-ray. Now, for younger folks, the body is pretty resilient. But after age 70, this radiation exposure becomes significantly more dangerous. Why? Well, a few things happen as we get older. Our body's natural ability to repair DNA damage from radiation slows down. Our bone marrow, which is very sensitive to radiation, becomes weaker. The contrast dye often used in these scans can be tough for aging kidneys to process. And here is the big one. The risk of cancer from cumulative radiation exposure increases over a lifetime. Each scan adds to that total. Here's the real kicker. Most full-body scans performed on seniors are done when there are no symptoms. They're just for a checkup, but when you're not looking for anything specific, false alarms become incredibly common. Imagine this: the scan finds a tiny, harmless spot on your liver or lung. On the report, it gets labeled suspicious. What happens next? Your doctor will likely recommend another scan, maybe a more targeted one. Then, perhaps a biopsy, which is an invasive procedure. All the while, you're living with intense anxiety and stress, waiting for results. A senior once told me, "The scan didn't save me. The stress almost killed me." That really says it all. So, you might be thinking, what about MRs? They don't use radiation, so they must be safe, right? Well, not so fast. MR is present their own set of challenges, especially for older adults. First, you have to lie perfectly still in a narrow tube for a long time, sometimes up to an hour. This can be very difficult and uncomfortable. Claustrophobia, the fear of enclosed spaces, can also become more pronounced with age, making the experience terrifying. The anxiety alone can cause your blood pressure to spike. And just like with CTS, MRs are notorious for finding abnormalities that are actually just normal signs of aging. We call these false positives. As we get older, our brains naturally change. An MRI might show small white spots, little shadows, or tiny areas where the brain tissue is thinning. To a radiologist's report, these might look scary. But in reality, for most people, they are completely normal parts of the aging process. Yet once that report says abnormal, the emotional damage is done. Did you know some common medical tests could actually be harmful for seniors without symptoms? Let's talk about cardiac stress tests. For people with real symptoms like chest pain, they can be life-saving. But for healthy seniors, forcing the heart to work that hard can increase the risk of rhythm problems. False positives are common, leading to unnecessary invasive procedures. Plus, the dye used can harm the kidneys, and many seniors even faint or feel chest pain during the test. Another one is the PSA test for prostate cancer. It's so sensitive it often finds tiny, slow-growing cancers that would never cause a problem. But once you know, it's a huge mental burden, leading to biopsies that can cause bleeding, infections, and urinary issues. Ultimately, treatment can lead to impotence or incontinence. The real tragedy? Over 70% of men treated aggressively likely never needed it. Stay informed and talk to your doctor about what's right for you. Hey everyone, let's talk about something that sounds completely safe, but can be surprisingly risky for people over 70, routine medical tests. We often think of these tests as a simple checkup, but for an older body, even small things can cause big problems. For example, something as simple as being a little dehydrated can throw off kidney function values on a blood test. Common medications can make liver enzyme numbers look strange. When these false alarms happen, it creates a wave of panic. Suddenly, a perfectly healthy 75-year-old might find themselves trapped in weeks of fear over a single elevated enzyme. Doctors, trying to be thorough, might order more tests, leading to a stressful cycle. This is because these tests don't just affect the body. They deeply affect the mind. Older adults are much more vulnerable to medical anxiety. When a report comes back with words like abnormal shadow or needs further evaluation, the mind can spiral into fear. This fear isn't harmless. It can raise blood pressure, ruin sleep, and even trigger depression. It reduces appetite and, believe it or not, can actually accelerate the aging process. This cycle of overdiagnosis and the stress it causes can silently shorten a person's life. Now, let me be very clear. This video is not saying you should avoid all medical tests. That would be dangerous. Some tests are absolutely essential at any age. Things like regular blood pressure monitoring, blood sugar checks if you're diabetic, necessary x-rays for an injury, or scans for sudden, unexplained changes in your health are all crucial. What truly matters is finding the right balance and only testing with a clear purpose. For seniors, the safest and wisest approach is called symptom-based testing. This means you only get a test when there's a real, tangible reason for it, a new symptom, a specific concern. It means avoiding those full-body, just-in-case scans if you feel fine. It means not doing a stress test unless your doctor has a specific reason to suspect a heart issue. And it means not panicking over minor abnormalities in your results. Always consider getting a second opinion if you're worried. Perhaps the most important thing is to choose a doctor who truly understands the aging process, not just someone who is an expert in a specific disease. In life, awareness is our best protection. Testing is an important tool, but over-testing can quietly become its own kind of danger. If you're over 70 or you care for someone who is, please remember this simple truth. Not every test brings clarity. Some bring fear, some bring complications, and some lead to treatments that were never needed in the first place. Knowledge, balance, and wise decisions. These are the real secrets to healthy aging. Thanks for watching.